Defender's Office, Health Department, and Office of Information Technology. So if the public defenders would like to step forward, we're happy to hear your presentation. Good morning.
Good morning, council members.
Good morning.
My name is Danny Engelberg. I'm the Chief Defender for the City and Parish of New Orleans. And I'd love to introduce folks at the table with me. To my left is Roddy Yarmelli, the Director of the Conflict Panel, who will be one of the things we'll be highlighting. Adrian DeBose, who's a new staff member joining the class of 2025 of our class of attorneys. Our Policy Director, Megan Garvey.
Morning.
Lillian McAbee, also, who's been at our office working her way through law school, but also joining our class of 2025 new class of attorneys. I want to thank everyone for having us. As you know, OPD's mission is to fight for our clients by providing excellent client-centered representation, reforming the system, and partnering with the community. The Council's historic parity law set in motion our efforts to have a baseline stability of an office that had been through years of fiscal crises, layoffs, and furloughs, but more importantly, to be in line with constitutional requirements and best practices. We have not fully reached those markers, but we are substantially more equipped than we were just 5 years ago. A snapshot of our priorities from 2024, we touched in fiscal year 2024, 18,586 cases across criminal district court, municipal court, and traffic court, and juvenile courts. We continue to prioritize staffing, and just last month, as I mentioned, we welcomed a class of 9 attorneys, 7 investigators, 3 client advocates. We increased salaries and compensation to be comparable to what the starting salaries are for new attorneys at the district attorney's office. And one of the things that I think that the parity law has done is be able to make folks like Lillian be able to work her way through law school while working at the public defender office, and be able to make being a public defender, in addition to her values and her mission and vision, an attractive place to work, to have a comparable salary that she can support a family, but also make a living. And the same with Adrian, who is a graduate of Warren Easton, of LSU Law School, and both are graduates of Southern University Law Center. And I would want to especially mention Adrian as being the recipient of District C's first inaugural scholarship that went to help support Adrian get through law school. And you never know what happens when the council does small actions like this, but we have living proof in Adrian that one scholarship can lead to increased public service in our community. We continue our long-term goals to increase our level of representation for conflict clients by expanding contracts and compensation and providing wraparound holistic support services for clients. We've added more experts to bolster defense efforts and provide more thorough, better case outcomes. We also continue prioritizing improved client advocacy through specialized practice, focus, and bringing in more people with lived experience who've been incarcerated themselves to be able to work and connect with our clients. We know that those closest to the system with their lived experience are critical to a collaborative approach that fully connects with clients, building trust and important rapport. We aim to meet clients where they are, to support and advocate for them, but also to work to put them in a better position than when they first came to us. And lastly, we remain committed to the Justice Tech Modernization Project to continue to integrate our work with the other system actors. For most people who are appointed to be a public defender, they are assigned to people in our client division, our full-time staff. but due to between 15 to 20 to 25% of conflicts or of where the person is, they are deemed a conflict, whether co-defendants or otherwise. They cannot be represented by our full-time staff and are therefore private counsel appointed to our conflict panel. Over the years, we've prioritized ways to make that representation more equitable with our full-time staff trial division work, to have both fully equipped lawyers, but more wraparound holistic representation. At the table, as I introduced, Roddy Ermeli, who directs our conflict panel, is here to explain a bit more of how we've expanded in 2024 our conflict panel representation.
Good morning, council members. My name is Roddy Ermeli, and I manage the conflict panel at the Orleans Public Defenders. In 2023, our goal was to add the sort of structural supports that the trial division has for their clients by way of contracts for social workers, investigators that provide crucial defense services. In 2024, we increased that number of people that are able to provide those services, but also the types of services provided, including interpreter services, client advocacy, mitigation support on long, substantial cases, and special litigation support to do research and advocacy the way that a full-time defense office would. Through your support in 2025, we aim to make those services guaranteed and that level of representation the default for any contract client that's been established through attractive pay, lowered caseloads, and increased administrative support. We're always looking for people to join the work that we do in any capacity they can to support our clients and the work that our very zealous attorneys do day in and day out.
As I previously said, we know that when we represent the person as a whole, not just the charge, we not only get better case and client outcomes, we support the wellness of clients and community and are an integral part of our overall health and safety network. Nowhere does this happen more thoroughly than with our client service division, where social workers, client advocates, and parent advocates address individual needs that contribute to system interaction and reduce recidivism. In 2024, they worked with roughly 1,000 people on over 1,700 client objectives. These are frequently clients with the highest needs that are often not met, just simply met with their case and in the courtroom. The top three issues continue to be, for the client service division, substance use disorder, mental health disorder, and housing. Our client service division also works to fill in the gaps for stability in not only housing, education, job training, but obtaining critical documents like IDs or driver's license so clients are able to get a job, a birth certificate to get Social Security, and get some basic safety net programming. They've provided unhoused clients with wallets to more securely keep their documents together, and transportation through bus passes and grant partnerships with Uber so clients can get to court, treatment, and other programming, work, or school. We know that public health issues are better addressed with their and discrete needs are met outside of jail and court. And however, we know that our client service division also just saves money. Millions of dollars are saved in jail costs and taxpayers to the city that are done when we can address the needs of why someone had the system interaction in the first place. I've seen it, we've seen it, that our client service division, the work with the public defender office, has been a significant part of the story of crime reduction. They're directly addressing barriers to client success and wellness. And when folks are stable and their basic needs are met, coupled with a support system that includes their social worker and advocate, we can break the cycle of recidivism. Slides 6 and 7 show our organizational structure and staffing. They give a snapshot of our budget positions, but are not a full position or a full picture of our best practices according to workload standards if we go to slide 8. We talked about this last year, but we still got a long ways to go to meet appropriate workload standards. A recent national study confirmed what we've known, those of us who have been practicing for years, that our basic workload has been far exceeding what needs to be in place to provide constitutional representation. A conservative application of these recommendations sets a maximum workload of 59 low-level felonies, for example, and no more than 7 life without parole or life cases for attorney per year. In the fiscal year 24, just as an example, OPD represented 7,545 felony cases this year alone and 388 life or life without parole cases. These standards mean that we are still a long way to go to fill slots to add to our staffing to be constitutionally in the right place. For example, we have 37 low felony attorneys when we should have many more, triple that, and currently 13 that handle our life and life without parole cases when we know that there should be upwards of 55. Our workload is entirely dependent on the demands brought by the prosecution. We are constitutionally bound to provide that representation and have been able to respond to the demands of the system. If the workload increases from prosecutorial side, we have to respond with the resources to adequately respond. Slide 9. As this council know, we've been having to adapt to the ever-changing needs of the clients in the community and the criminal legal system as a whole. When we fail to meet our guidelines, and the entire system falters and the most vulnerable community members suffer. 2024 has been an exceptionally busy year at Tulane and Broad itself, with a record number of jury trials as well as numerous judge trials. In addition, sweeping legislative changes from the last crime session have been significantly impacted our work and the effects of our clients. As this council knows, we are fighting a crisis in our jail population, which also significantly increases the pressure points of our work. Increased in addition to an additional policing force with Troop NOLA, an additional prosecutorial force and the attorney generals, and increased sentences with the elimination of parole and good time parole, and more people on the adult side with the lowering of the age from 18 to 17. All of these changes stress an already overburdened system ill-equipped to adequately and appropriately address a myriad of public health and social needs of the community, and require OPD to adapt even more to meet the moment and best serve our clients. I'm not sure the word has gotten to you as council members, but the pace at Tulane and Broad has been, I think, historic. We have had, as of the end of September of 2024, with still months to go, 126 jury trials alone in criminal district court. And one of the things that we are seeing as a result of the parity law and our being able to start to meet our constitutional requirements is that our clients have more faith in us to be able to go to trial, and have seen the results include that whereas held power accountable and protected innocence. This is a testament to the importance of OPD and public defense work toward the right outcomes for clients, and also this council's investment in our office and in our community. Next slide. How do we respond to the changing and needs and the meeting the moment as we discussed for the next calendar year? We're going to continue to focus on staffing to replace attrition, grow divisions, and meet public defense workload standards, as well as local, state policy practice and legislative changes. We're also look to match what the district attorney's office is doing, and adding dedicated trial assistants to support our legal and case teams during trials. And also the greatest needs remain the increase in number of major felony attorneys. These are all these positions that are the most difficult to fill and retain. We're going to continue with the work of Mr. Yaramelli and our incredible conflict panel attorneys and their teams to grow and improve our conflict representation to make sure it's more equitable. We're going to bolster our advocacy for clients through mitigation and case management, particularly mentorship among young clients, as well as continue to focus our hiring to increase what we've already increased for people who have lived experience in the system. We're going to continue to grow our mental health unit and to address our mental health crisis in our city. We're going to address the increase in Gwen's Law hearing by increasing our staffing in magistrate court. And we will focus on, to meet the moment of the jail population crisis, to keep providing the courts alternatives to incarceration, particularly at first appearances and through the screening period of someone's case. We also hope to find a permanent home for OPD. I've talked to you individually about this, but as you know, our building is for sale, and we need to find a permanent home that matches what the district attorney has, and right there on that corner in that space. We spend close to $1 million a year in rent, and that's money that could go to additional staffing and projects to directly help our clients. We have this opportunity potentially to buy the building that we currently have, and we know that we would like to make this calendar year a place that we have a permanent home.
Hey, Danny, can I ask this question? Obviously, $1 million a year in rent is a significant figure.
$500,000.
$500,000,
Yeah.
sorry, $500,000. Still significant.
Yeah.
How much would the building cost to buy in round terms?
So I believe their asking price has been between 7 and 8 million. It's been on the market for a while. And I think, especially if we were able to get additional local support for a down payment, we would be able to bring that price potentially lower, and potentially where our monthly costs could be comparable or even less than our rent.
Okay.
And in addition to providing a stable place that we know that we can be in and do our work without the uncertainty of potential eviction, we know it'll be an incredible morale boost for the office. But we also have, as you guys have seen, and we've talked to you, we've worked with partners in the community to really have a vision for a no wrong doors type of building that not only helps us cover the cost of the building, but also provides a place of wellness and support for our clients that sister agencies and sister offices can also be in that building. And so we have grand hopes that this is the year that we can have a little bit more stability where we live, but also have a vision for revitalizing that building and that corner to both support our clients and our community.
So, I'm not trying to paint you to a corner and ask, this isn't cross-examination, but if a down payment would be somewhere between $1.5 million and $2 million,
Yes.
that's what OPD would be seeking?
Yes.
Okay. And then we obviously have had issues with city buildings. Would OPD be responsible for the upkeep and maintenance of the building as well?
So unless there is a pathway for the city buying the building, which
Right.
is comparable to what the district attorneys have it,
Right.
yes, if we were provided additional dollars to put a down payment on, we would be responsible for both upkeep management and also, I think, revitalizing that space. It's as people know, that is an iconic spot that was originally a state building, the welfare office, and has been through lots of changes, as has that corner. But we think that corner and that area can be a real symbol of, instead of a neighborhood that has been struggling to rebuild, but of revitalization, but also a place of health and wellness for our clients and community.
Go ahead.
Also, Councilman, I just want to point out, in terms of being good fiscal stewards, the amount of money that we have spent in rent since we have been in that building could have bought the building.
Right. Well,
so it's great bang for your buck.
That's why I asked the question, because it seems like it's better to have a home than have the potential to be kicked out, and ownership is better, I think, in this instance. Do any of my colleagues have any questions about this?
Yes, I do.
Councilmember Green?
I have a question relative to the annual maintenance cost of this building. I know that this building is very old. I've
Yes.
gone to it for a variety of meetings. I'm not sure that it wouldn't require some significant renovations, or I'm sure it would require some significant renovations. Do you have an estimate of the cost? Because it's not a matter of buying it,
Sure.
then putting $500,000 a year into maintenance of elevators, HVAC system, and the like. Do you have an idea of that?
So we're still in some early stages of figuring that out, but you're right. It's a 50-year-old building with a lot of things that need to be refurbished. But we think that we can leverage city dollars with public and private partnerships to be able to meet those costs, in addition to the revenue from the rent itself.
Mm-hmm. Right. I just caution you relative to kind of what I happen to know about that building
Yes.
in terms of some of the long-term repair needs. That's all. But obviously, that's why we're here, to try to
Yes.
work things out.
Yeah, I mean, one of the things we do know that since it's been up for sale, that they've been sort of in a holding pattern for any fixes. So we're going to have several years to catch up. Yeah.
Okay.
speak for a couple of seconds. I know Mr. Druso walked away. I had my button pressed, but I guess that doesn't matter. Danny, I appreciate the work y'all do. I mean, I got my career started working pre-OPD, Meg, what was it? OIPD? Office of Energy Public Defense. I'm glad y'all dropped the I because it was kind of demoralizing to our clients. But
Yes.
and you guys have had a history of working with this council even before parity was a thing. And we're still not quite at parity, but we're like slowly making our way there. The building, it's just so interesting because the building that y'all operate in is so indicative of kind of what your clients go through in that you've got an older building, you've got a disinterested landlord who kind of wants to dump it so he's not fixing it, and the parts are falling off, which you would think ultimately might lower the purchase price, but it's also an anchor piece for a neighborhood. That is a neighborhood where people live. And I think to y'all's point, I think the idea of having a permanent home, putting actual roots in the community you serve, as well as revitalizing something that can anchor the neighborhood in itself, it's all worthwhile. It's for us to try and figure out how we can make it happen. I do think also it's just very difficult to find any suitable building near Tulane and Broad, generally speaking. So if not this property, there really isn't much else around there other than new construction. And if we want to talk about, you know, the sticker shock of buying this older building and repairing it, the cost of building a new building would be exponentially higher. And even though the city has plenty of land around Tulane and Broad, we can't even get House of Detention torn down. So any idea that we would be able to figure out somewhere for you to go in the near term, should you lose that space, it's pretty much not going to happen. So I think having a more robust conversation about what that purchase looks like. Also, I'm sure y'all can work on a business plan on how to fully utilize the space because it's more space than you need. And you could be anchoring businesses that help your clients, that help the community, that serve purposes. But the quicker we can get together to have that more robust conversation and that plan, the better, because if you do lose that building, I still don't know where you'd go.
Right. We think our only option is that building, and the building actually, they did have an offer to, and they were going to kick us out. That offer fell through. And so if not that building, the only other option, which we've talked to many of you about, is Augustine across the way. And as you said, that's significantly the scale of cost of that.
If you haven't been in Augustine, you can see through the floors.
Yes.
So I mean, it's one of those things where it would be fantastic if, I mean, God forbid the state terminate historic tax credits, Augustine will never get done. So I mean, it's a great location. It's historically significant, but it's got the problems in that building make your building look like a Ritz-Carlton.
Right.
So I mean, it's a challenge. And obviously, we need to work through some of the mechanics of what the costs are going to be and how much we can leverage private individuals who want to help, while also not giving the owner an inflated idea of how much the building's worth, which is always a challenge with these owners. But it's just a conversation that needs to be had.
Yes.
Thank you.
Thank you.
Thank
Councilman.
you.
Not that long ago in 2020, this council did something truly historic and momentous to make New Orleans a more equitable and fair city in passing its parity law. As you have mentioned, one of our things that is still outstanding is that our counterpart has a home, an office that's funded by the city, and we don't. So we're looking to tackle that in addition to the other needs we mentioned. We know that parity contributes to a more fair and just legal outcomes, protects innocence, and addresses wrongful arrest, prevents wrongful conviction, and increases our ability to identify and address the root causes of system interactions for our clients. We are grateful to the mayor and this council for your continued support and recognitions of the importance of equity in funding and resources, and we are committed to representing our clients to the very best of our ability, not just for them, but for the betterment of our community. And if there are any other questions, we're happy to answer them.
Good morning, everyone. I'm Machinist. Excuse me, allow me to sign in. So I did want to ask if you could briefly tell us the young look like the new, fresh-faced young lawyers at the desk with you all. Introduce them to us, please.
Good morning, council members. My name is Lillian McAbee. So prior to working at the Public Defender's Office, I had personal knowledge with friends and family who had legal issues who were helped by the Public Defender's Office, and that led me to apply. And I applied as a legal assistant, and then while I was there, I was able to get a more in-depth look of the work that the attorneys, the social workers, and all the employees at the Public Defender's Office do for the citizens of New Orleans. So I then decided to apply to law school, and while in law school, I worked at the Public Defender's Office, and that really helped me see the great work that it does and how it really helps everyone. So I'm now a staff attorney at the Public Defender's Office and plan to retire at the Public Defender's Office just so I can continue the mission and, as we like to call, my why, to continue to advocate and help the clients and just help everyone the best that I can.
Thank you.
Good morning, council members. My name is Adrian Dubos. Can you guys hear me?
Yeah.
Okay. My name is Adrian Dubos. Prior to starting at the Public Defender's Office is prior September after my training, 6 weeks. That was great. That the office gives us. I spent my time at Southern University Law Center, and during my time, during each and every summer, I worked at a Public Defender's Office, and I saw the importance of it. Being from the city, I saw a lot of people going to school with, and like just knowing a lot of people that was a part of the criminal justice system. And I always saw the commitment of public defender's offices, and it made me want to start here. So I passed the bar, and I started off strong at the Public Defender's Office. So I'm pleasure to be here for you guys. Thank you so much. Thank you.
And you missed this, Councilmember King. I did highlight the scholarship that was a District C scholarship that was probably unbeknownst to you, was part of the path to having such a great new colleague at our office.
Well,
we appreciate that scholarship, but also just encouraging folks to invest in public interest and public service in New Orleans.
Absolutely. And I see you got that purple tie on, not for St. Aug, but for Warren Easton.
Yeah, there are some other purple and golds out there. All right.
It's glad to see a young man from the city, public school, Southern Law Center grad like myself, who was back home, could have had, I'm sure you had other opportunities and could have went to different cities and different departments throughout the country, but coming back home and helping your city is a rarity. So I'm glad for both of you all in your journeys, and I can't wait to see what the future holds for you. So thank you all for being here today with us.
Thank you.
And thank you for hiring him. I know when I was looking for a job at the PD's office, it wasn't as easy.
Well, we have definitely, we're thankful that for the support of this council that has allowed us to be able to hire incredible folks like Lillian and Adrian. And I would just say, overall, and I know I'm biased, but the folks at this table and the hardworking folks at the Orleans Public Defender's Office, I think represent the best of public service and are truly dedicated to improving New Orleans and our community. And we appreciate the council support. We appreciate the ongoing dialogue to make sure that we continue to tackle our goals and objectives for 2025.
And if I may, colleagues, I'm sorry. I know I'm late and I'm not blocking the time. I know Councilman Jeruso discussed the building. Mm-hmm. Just how much easier, if that's been discussed, you can just gloss over it, but how much easier would it be to have your own building, and what can you do as far as community outreach if you had your own building that was yours?
Do you want to answer?
Sure. Well, as Danny discussed, I can touch on just a little bit more. I think we have a vision for us to have stability, for us to be able to put down roots and weather any political or literal storms. So I think that would make a big difference and definitely be a morale booster, but we also would love to be able to partner with other organizations and give them a home to make it easier for people who are coming out of the system and to get all of their needs met in one place, right? Rather than having to take multiple buses to go here, there, everywhere. Have a place where people can come where they feel comfortable to meet with their lawyer about their case, but perhaps also have other programming and things available to them all in the same space.
That's it for my questions. Thank you, colleagues, for bearing with me. Thank you all for the presentation.
Thank you.
Anything else? All right, Mr. Burnside, I'm not going to forget you.
So when I put in the card, I had a bunch of positive stuff to say. Now I've got 50-50. So let's do the positive first, as Councilman Green taught us, which is that I'm in favor of public defenders. I'm glad that they exist, and I wish that the parity law was really parity, because I think you guys are at least $1 million behind your opposition. Moving on to the discussion of buildings, we just finished giving NOPD a landlord, and the reason we gave NOPD a landlord is they asked for one because the city was not taking care of their building. No air conditioner, no elevator, rats in the evidence locker, and all the rest of it. So, city owns a lot of buildings, including a old and no longer used NOPD headquarters that are in the vicinity of Tulane and Broad. So the idea of buying a new building, I think, is sort of like the idea of the new city hall. We pretend that the old problems will not follow us into a new environment, and I think we are unwise in thinking that physical solutions to social and political problems are long-term and enduring. So I would not necessarily agree with the buying of yet another city property and taking yet another piece of property off our tax rolls. Thank you.
Thank you. Thank you all for being here this morning. We appreciate it.
Thank
Thank
you.
For
you.
the time and the hard work. All right, next up will be the health department.
We're down.
Oh, yeah. Get my check.
Yeah.
Have a good day.
Yeah. Hold on. It's just stated. I have it. Oh, yeah. Oh, it's not. Oh.
Ready? Okay, great. Good morning, everybody. Thanks for having us. Jenna Vegno, Director of the Health Department. To my right is Jocelyn Johnson, who oversees all of our fiscal and administration efforts at the Health Department. And we've got a ton of our fantastic staff in the audience. So I'm really excited and proud to be highlighting our team's work from last year and tell you a little bit about what we're planning to do for next year. So it was really impossible to distill all of our progress last year into a few slides, but I'm trying, and I'm going to hit the highlights. But we have really accomplished a lot, and that's because, again, we have such tremendous professionals working in the health department. We organize our goals and priorities based on the CHIP, which I'll talk about in a bit, but we have three main priorities, and so I'll just highlight some really exciting work that's happened over the last year in each. Our first is increase access to care. That's a huge bucket that encompasses an awful lot of programs and initiatives. And just sort of starting with our vulnerable populations with healthcare for the homeless, we've really doubled down on making the bridge between clinic services, hospital, and really getting into the street and expanding our offerings on street meds. So we're very proud of that. We also care a lot about our employees' access to healthcare and wellness, and you'll hear me talk about that a little bit. And so I'm really pleased that we have developed, implemented, and have a really robust internal health department quality of life committee that evaluates what we're doing, how we're serving our workforce, and comes up with solutions and ideas to improve morale, recruitment, and retention. We've, in the maternal child health space, obviously, we spend a lot of time. That is a core priority area for us because we know there's really no more critical work in health than we do than to invest in the life of a young family. As you've heard at this council, before this council, our Family Connects programs are operating in both hospitals, and I really appreciate both hospitals being here to support us today. They are really making tremendous strides and hitting milestones and being in families' homes, providing them with basic needs at a very critical time. So we're really proud of the work there. Behavioral health is another core pillar of what we aim to do to improve the health of our community. You've heard a lot about MCIU, particularly during times of disaster when they really stepped up and performed some additional functions. But the volume has exceeded what we expected and continues to grow month over month. We also spent a lot of time this year working on our opioid settlement plan, though I think we wanted to do it right. So we did a very painstaking strategic planning process with stakeholders, people with lived experience, policy, academics, folks on the ground. I think that's ultimately going to produce a really great plan, and we have it finalized and are ready to spend the money. We all wish we could have spent the money 6 months ago, but I think doing it thoughtfully and in concert with those who are most affected is going to give us the best long-term results. Thrive Kids continues to grow and expand. They are now, as of this school year, in 19 schools intensively, while still providing care coordination to every school across the district. Since August, they have held over 1,100 counseling sessions, and they have nearly 1,200 students enrolled in care coordination. That is a huge number. For our very fragmented school system, this provides stability and consistency in behavioral health support. In terms of access to care, where we're still trying to make progress, I think I would put this slide under fragile infrastructure, which I know has been a theme before this council. And while our infrastructure is often human, it is sometimes physical as well. Our Healthcare for the Homeless clinic, which had been in the VA and the CRRC for years, simply cannot continue in that building. It is not reliably open. It does not provide the services that we need for that population. So we had to pull out of that and expand our efforts, or double down our efforts in Central City and Oz and Amin, but we really need to expand and have a more stable place, and that will allow us to expand our patient volumes as well. Infrastructure, I think, also is sustaining recurring funds for our core programs like Family Connects, like our AIR program that I'll speak about in a minute. So these are the goals that we really want to work on for the upcoming year and beyond. Our second priority as a key driver of health is economic stability. In fact, this might be the most important determinant as to whether someone lives to 88 or someone dies at 50. And so we have a lot of work going on in that area. I think this council is very aware of all of the work of our policy and advocacy division. both on the state and local as well as the federal levels. We've come before you many times with ordinances. We truly appreciate your support. We will continue to come. We just came before you for carbon monoxide. We've got a whole bunch of offerings coming, and we've made a lot of progress. Food security is a key determinant of economic stability. You may have seen last week we released a local report on food insecurity, as well as some recommendations that we would like to turn into action. We've already begun the action with our ARPA allotment for food insecurity programs, and those are making great progress as well. Some of the things that we were not able with our partners to quite push over the finish line is paid family leave. While the city really stands as a model in its paid parental leave policies, we know that the rest of the state and our local businesses do not really have that same standard. So our team is very active on the coalition that has been pushing for statewide family leave in increments, but with the goal towards a more comprehensive offering for everyone in Louisiana. And our third main priority identified by our Community Health Improvement Plan was ensure community safety. That means a lot of things. That means things like disease surveillance and environmental health, making sure that everyone has a safe place to live long term. And it means traditional ideas of safety with our violence prevention work. I think this council also has heard about our progress in developing what we call a robust and comprehensive violence prevention ecosystem with our hospital partners and our community partners and our academics. And again, I want to thank many of the folks who are here today to support that work. Our domestic violence programs continue to grow. We're very proud that the AIR program has been operational citywide since the beginning of the year and has responded to thousands of calls with hundreds and hundreds of referrals made, and with folks having the ability to better safety plan and stabilize their family after a traumatic incident. We've really doubled down on some of our injury prevention work that we hadn't been able to do previously. I hope everyone has had an opportunity to look at the transportation safety dashboard. It provides a lot of information just in terms of where accidents are happening and how severe they are, and it gives us a lot of data to build on those results. Our firearm safe storage program is near and dear to my heart because it is practical, a practical, simple public health approach that is grounded in speaking to people who own firearms and asking them what they want, and then delivering that result and evaluating it and finding out that when you listen to people, it really does work. We're really, really proud to be able to enter the second phase of that, to give out more than 2,000, we hope, biometric safes with our hospital and community partners, and we're really pleased to be recognized as a national best practice. As we think about community safety, we do still have holes in our Office of Violence Prevention that we're hoping to fill pretty quickly. And again, just to continue to grow and expand our community-based, community-led, public-private violence prevention strategy and model. So that very, very high level, there's lots of more details, but I know our time is limited. So what are we doing in 2025? Again, we operate from prioritizing programs, initiatives, policy, you name it, from what our community health assessment tells us and our resulting community health improvement plan. And why is that? Because it is a broad and diverse plan that we have 238 partners who help us implement it from 123 organizations across the community. We're very proud of that. It would not be a real community plan if it was just the health department telling everybody what to do. We are, it seems like just yesterday, but it's about time to redo the community health assessment. And I think this is a really good time because we're several years past COVID and we need to really figure out where are we now compared to where we were 5 years ago. So we will be updating the plan in 2025 and updating the assessment, and then from that, updating the plan. We are always looking for new partners. If anyone listening has a community organization and you are not part of our CHIP coalition, we would love to have you. when we get down into sort of the specifics of what our goals are, again, we are proud of our direct service programs like Healthcare for the Homeless. We are proud of their mission to serve our most vulnerable and everybody else. And we want to make sure everybody knows it. Hopefully you've seen some billboards rebranding as HCH. This does not diminish in any way our commitment to care for the homeless, but we want to expand it to everyone because we have some really great programs. We have a fantastic dental program. We've added women's care. We've added behavioral health. And so we want to make sure that the community knows that this is for them. And we also want to make sure we are in the community in a way that is uninterrupted. Our hope for this year is to expand to New Orleans East, recognizing that that is an area with a lot of folks who need care of all kinds. We are looking to expand there, particularly our mental health offering, because we do know that it is a mental health desert in many cases. Our health equity team has been hard at work evaluating our programs, and we're soon going to release an update from a 2013 report that really drilled down and identified where are the health disparities in New Orleans, so we're looking forward to that. And then again, we'll be doing a ton of work to sort of figure out where we are post-COVID in terms of disease and health outcomes. Our Family Connects program is on track to exceed the goals set. The process for accreditation by Family Connects International is pretty rigorous, but I think we are already there. They'll be visiting us in January, and we should be officially accredited. But, you know, again, we're not simply stopping at our visits, even though they are tremendous and preliminary data is really spectacular in terms of improving outcomes. Every time our nurses go out, they identify more needs, and we really want to be able to address basic needs. You've heard us talk about the newborn supply kit program that we partnered with HHS on. We are really excited. We're hopefully going to announce soon some philanthropic funding for that will provide a newborn supply kit for every birth that Family Connect serves. So you don't just get the home visit, you don't just get the referrals, even though those are tremendous. You actually get material goods that anyone who has had a young baby knows that you need, and many of our families need them quite desperately. Our other maternal child health programs want to continue their progress on breastfeeding rates, on getting folks in prenatal services early. All of our Healthy Start case managers are trained as doulas. There's been tremendous improvement and movement on doula care statewide now that it's a covered service. So we want to make sure that every New Orleanian who wants a doula has a doula. Our Healthy Start program, unfortunately, is often caught up in federal appropriations back and forth. I don't know why it would be, but it is. So we really want to work with our federal partners to stabilize that so we don't have to ring the alarm bells with our congressional delegation every single year. And then you hopefully will be seeing an increased education and outreach campaign telling the city residents about all of our family services. We do know that there's a lot of folks that don't know about all the things that we do for young families, and we have capacity to do more. So we want everyone to know that there is a program for them. In terms of behavioral health, we've had a lot of growth in this area over the last few years. So for our core programs, MCIU, LEAD, Sobering Center, we want to continue to stabilize, maximize our efforts, make sure we are serving community in the best way possible and as efficiently as possible, and we are really filling gaps in the behavioral health landscape. Again, I think next year will be a transformative year for opioid use treatment. We are finalizing the notice of funding award from the settlement funds that will be released publicly, looking for proposals for some really transformative programs, again, informed by folks who use drugs, folks who treat them, to fill the gaps that we know exist in our behavioral health, particularly our substance use world. And again, Thrive Kids is actively expanding. Their goal was to get to 20 schools with folks on the ground, and they are one away. I think they'll have 20 in the next couple of weeks. They serve a broad and diverse set of families all over the city. There is not a zip code or a neighborhood that they don't touch. But what we really are doubling down on this year is evaluating the outcomes. There's some very promising data that what their work does is really supporting kids academically and in terms of behavior issues in school. We want to know exactly what that is so we can continue to advocate for this funding. We know it's likely going to be another busy legislative year, and I think everybody knows that the health department is not shy about advocating for the needs of our residents in the face of often opposition, if not outright hostility. We are proud to have many, many medical experts that are willing to help just continue to bring pure science and reason. And so we expect it to be a very busy legislative year, both at the state level and also at the local level. We are doing a lot of work on supportive work environments. Again, not just with our work with the Workers' Bill of Rights, but within our own department, recognizing that public health is hard work and often goes unnoticed. That's why we have been fortunate to get transformative CDC funding that funds worker recruitment, retention, and wellness initiatives. So we are able to offer our staff a whole range of services, things like professional development funds, additional travel funds to support their work, and things that make them feel valued and want to stay at the New Orleans Health Department. Food insecurity, again, is a key priority of this. We have two staff actually that work almost exclusively on food security, and I think that's appropriate. One of the focus that we'll have next year is we want to increase our ability to enroll folks in SNAP. There is a large number of people in the city who are eligible for SNAP benefits, but for whatever reason are not signed up and do not receive them. That is a low-hanging fruit. If we could simply get everybody who is eligible for SNAP benefits their benefits, that would go a long way towards combating food insecurity. So that's going to be a real focus. I'm also really excited to say that, again, thanks to some new staff brought to us by the CDC funding, we have been named a CDC Diabetes Prevention Program, which means we will be building out some programs and initiatives in the community to combat diabetes. We have never had this ability before. We have not had the ability to double down on chronic diseases like we do now. And these are the things that kill most New Orleanians: hypertension, heart disease, and diabetes. So we're very excited to have that added capacity to really drill down on these critical issues. We want to make sure that we are providing healthy homes with all of the support that it needs to thrive. We have, with the carbon monoxide ordinance, thank you all very much for supporting that. That came about because we were in people's homes noticing that this was a problem, and because we know that people died during Ida in various parts of the state from carbon monoxide. So this is a way we really want to partnering with NOFD and Healthy Homes to make that robust. We are taking the lessons learned from Francine in terms of our independent living facility ordinance and making sure that we are adjusting and refining and getting ready and better for the next one. We are really proud to support the Office of Homeless Services and Strategy on their tremendous work with the encampment decommissionings. We provide the public health justification. We are doing health assessments in order to help them quickly use the vouchers they've been giving to get 100 people more off the streets, in addition to all the wonderful work they were doing by the end of the year. So now we are committed to helping them finish the job, decommission the encampments, move to maintenance, and the strategy and the systemic change that is going to hopefully prevent us from ever getting to that point again. In community safety, again, we want to continue our direct services, our support for vulnerable populations like our individuals living with HIV. Through some transformative work from that division, we've been able to get additional fundings to directly address social needs, basic needs that folks living with HIV have struggled to meet so that they can then fully engage in their care. Our emergency preparedness division has been very busy. They will continue to be busy. through Super GRAW and beyond. We are also finding ourselves needing to really step into the gap with vaccinations. There is a deprioritization, quite frankly, of vaccinations, childhood and flu and COVID at the state level. That's unacceptable. In a city where we saw how many people died because of COVID, and we now have the tools to address that, we are going to ramp up our efforts to make sure that everyone who needs a vaccine has some kind of access to vaccine. That is a really heavy lift, but our team is committed to do that. For violence prevention, we want to continue to evaluate. The AIR program will be here on Thursday, I think, talking a little bit about domestic violence and sort of where we are with that. As our violence prevention ecosystem has really matured this year, we want to make sure that every part of it is working as well as they can, whether that's our community violence interrupters on the street with Ubuntu, whether it's our hospital violence intervention program that's responding in the hospital, our trauma recovery center, which I'm excited to say continues to grow month over month and seeing patients and their families who are victims of trauma. We know that there are lots more and we can do in lots more places in the city, and so we really want to look at how that rolls out this year. And then, of course, our safe storage program is rocking and rolling. Next week, we'll be actually doing biometric gun safe giveaways for our public safety first responders here at the city. Because when we were at Night Out Against Crime, we noticed that folks in uniforms kept coming up to us saying, I'd love a safe. I've got guns at my house because I'm a law enforcement agent. And when you do the research, you realize that law enforcement personnel are at extremely high rates of gun-related trauma, primarily suicide, and that if they have children in their home, their children are at high risk. So we want to support our public safety workers, whether it's NOPD, EMS, fire, OPCD, and provide them with the same tools we're providing the community because they are the community. Again, thanks for the carbon monoxide ordinance. We just received a pool safety grant, so we're going to be working there. I hope you've all gone to the transportation dashboard, and we want to not just use that dashboard, but really look at the fatalities and understand what do we collectively as a city need to do to make the roads safer. We have a very big organizational chart that I will not go into. So here are our FTEs. You'll see that it looks like there's about 12 or 13 extra positions from last year. These are a result of the CDC positions coming on for this year. So these are we are not adding any new positions this year. It's just from last year to this year, the CDC positions rolled on. So including vacancies, we have 120 positions, which is a lot. Right now, we have 7 vacancies. 4 of them are grant funds, 3 of them are general funds. That is a big drop for us. We routinely would have 15 to 20 vacancies. And the difference has been, I think, a few things. Our ability to make NOHD a really attractive place to work with a lot of the various incentives we can use through our grant funding. And then with that funding, we were able to competitively procure a recruiting firm who goes out and finds candidates for us, vets them, puts them through their paces, and also is an intermediary with civil service for us. Ask them when the tests are going to happen and did they receive the formal application, and shepherds potential hires through the process, talks to them regularly. This takes a tremendous amount of pressure off of our managers who are trying to sort of do their jobs and don't have the time that it takes to really go out there and look for candidates. It's a national candidate pool, which is very helpful. Again, we're very lucky we're able to do this with grant funds, but I would recommend any department that's having trouble hiring to just think about maybe creative ways that they could just enlist some assistance. So finally, we get to the money. And I do want to explain why it looks like we are cutting personnel by $4 million, but keeping the same number. The reason for that is that many of our employees, if not most, are grant funded. our large grant funding programs like Healthcare for the Homeless, Ryan White, WIC, Healthy Start. Their funding comes up generally every year. And every year, we try to ask for more, right? We try to ask for more things to do more programs. So the bulk of this money is us in 2023 being optimistic and saying, we're going to put in every person that we think we might get from a grant and hope for the best. We didn't, for the most part, our funding was, the federal funding remained flat last year. I think that was a consequence of all the appropriations back and forth. So the positions that we asked for, the extra positions, we did not get funded. There were 2 grants that rolled off that had a few personnel attached to them. They've gone to other positions. But I just want to make the case that we are not getting cut. We are maintaining all of our positions. We're not getting more positions, but we are not getting cut. And the operating is the same. We always ask for more grants, or we always are optimistic when we put in our projections for the budget, hoping that we get everything we asked for, and we just didn't. So largely our budget is remaining flat year over year. And then just really quickly to go through the ARPA, we've talked about gun safety. Again, that's rocking and rolling. We've had, I think, 4 events in, we've given out a couple of 100 safes just in October. We'll be here next week. And the plan is, again, our strategy is to really look at where pediatric, younger than 18 shootings take place, and to try to, as much as possible, put events in those neighborhoods so that we can match the need to what we have. We talked a little bit about our food security program. There's 4 different things going. If you haven't been to the Fresh Stop Market at Sankofa, I believe it's open now, and that's really exciting for the Lower 9 community. Sobering Center had a really great year. They are routinely seeing a high number of clients, and that wasn't always the case, and that is not always the case with other sobering centers around the country. They have proven themselves to be incredibly helpful during disasters and really almost as an overflow shelter when we need extra capacity. So we're really excited about the work that they've done and their remaining commitment. We talked a bunch about Thrive Kids, and they'll be back to present their findings to you, I think, in January. And then we were able, with some ARPA funds, to kickstart some of our violence prevention work. One of them is the Center for Restorative Approaches, which does restorative justice circles in schools. These are very, very deep conflict mediations between kids and families and folks that don't even go to that school, where they really get into the conflict and work it out. And they are in a whole lot of schools and are called whenever a school feels like there's a conflict that's about to go off. So we're excited about that. And then medical debt. We had some very exciting news. I know Ochsner is here, but both Acadian and Ochsner canceled millions and millions and millions of dollars in debt. And I don't know, hopefully you all got some good feedback on that. It was really surprising to me, the number of people that texted me and said, you might not know this, but I had a couple $1,000 bill that I just couldn't pay, and I was afraid to go to the doctor, and this is a weight off of me. So we're really excited. We continue to work with LCMC to do the same and to get that money completely spent. And I believe that is it.
Okay. First up, Councilmember Thomas.
Thank you, Dr. Vegno, and definitely thank the men and women of the Health Department. Your presentation was really kind of helpful in terms of my conversation, because you mentioned a lot of things about expansion, focusing pockets of community. A TCA report that was done decades ago on abject poverty actually highlights, it should be a case study for anyone, especially in leadership or if you're dealing with disparity. It highlights that even when New Orleans experiences lows in crimes or ticks up in opportunity, economic opportunity, there are communities that are untouched. Post-Katrina, the demographic shift is obvious. So you mentioned expand to New Orleans East. If you look at the demographic shift post-Katrina, Algiers and New Orleans were drastically affected because people were pushed out of the core of the city. New Orleans East, is, with the portion of District D that's attached to it, would be the sixth largest city in the state. Dr. Mouton, Dr. Davis, the study they did on chronic illnesses with New Orleans East Hospital and Dr. Davis's wellness initiative show that the highest cases of chronic illnesses are in New Orleans East. The study that was done on childbirth shows that more black babies are born in New Orleans East, in that part of the Ninth Ward that's attached to it. So why are we waiting to invest or expand in New Orleans East? Why has that area been so neglected, especially given its history and its demographic and its relationship to chronic illnesses? Why haven't we not, in your words, expanded there yet?
So we haven't been waiting, and that's why some of our universal programs, I'm really excited. When you look at Family Connects, they've been able to serve a tremendous number of families there. In terms of HCH, because of its historic, mission as serving the homeless, clinics like that have traditionally been in where most of the homeless are, right? And for us, that's in the downtown area, Claiborne, Calliope, and then parts of Central City. And so that's why the rebranding allows us to think in a different way and put behavioral health services there. While we know there are certainly more primary care services than there were, not saying that it's sufficient, we know that behavioral health services is an acute need there. Same with food security, same with our diabetes prevention program. We've never had one before. We've never really been able to address a lot of chronic disease, but I will tell you that where we are looking to partner to do it is in New Orleans East, because again, we want to go where the need is greatest. Now that we have the ability to serve, that's where we want to be.
You mentioned food deserts, but in those areas we talked about, it's quality education desert, economic investment
That's right.
desert, access to services desert also. And at one time, that community especially had 3 hospitals and neighborhood clinics. Dr. Kevin Stevens talks about the gap to quality health care. In the last 6 years, if you look at the data study, Center's report on economic viability and who's left out of the economy, you can track that everything that you're mentioning in terms of how we're trying to make it better, in those communities, in fact, the disparity has gotten, and the gap has gotten wider in terms of access to quality health care as well as economic access. So how do social scientists and people in the medical field take a look at that data that it's not new? You can go back to 2005 and then kind of track how it changed. So why are we just looking at those areas? And we've resourced a lot of areas since then. Why are we just looking at those areas? Well, now to invest in. And I think this is important for folks, especially who have money, philanthropy, controlled budgets. We have a whole desert out there, not just food desert, but access to quality healthcare desert, that the information has been there.
Yeah. Again, 5 years ago, we didn't have any funding for chronic disease, postpartum home visits, behavioral health services like we do now. So I think it's not that we didn't know, right? It's that we did not have the same kind of ability. Do we have sufficient to address the need and really start there? No, I don't think we do. But when we get that ability, right, now that we do have the ability to really resource, particularly in the chronic disease space, that's the first place we want to be. The things that we make universal, we want to make sure that they are also serving the East, and they are, because we know that, like you said, probably more babies are born out in the East than anywhere else. So the fact that our both hospitals can serve out there.
Well, black babies specifically. That's your largest African-American demographic.
Right.
Not because I say it, but because the numbers say it.
Right. So the fact that both of our hospitals now are going into the East. Remember that the concept of going to someone's home is both retro and new. And so I look at those statistics very, very carefully to make sure that the families that are there know the services for them and want to participate. We've always had a WIC clinic in the East. We've always had Healthy Start out in the East. That has never wavered nor changed. But as we have the ability to add more programming, we know that that's a priority place to be.
And I'm only mentioning that in terms of the budget, especially with so many professionals here, is because those numbers, when you talk about the disparity, have been around for decades, maybe a century, even if you go back to the 60s to track what's happening in terms of the demographic now. But there was a solution back then. We didn't have healthcare access in the neighborhood I grew up in, so the city teamed with other resources to put a neighborhood clinic.
Yep.
Same thing with other parts of the Ninth Ward, other parts of Algiers and other community. So what was it about because the demographic shifted and actually grew in terms of who populated those communities, but the resources didn't follow? Because in the 60s, the resources followed the demographic because the disparity in the chronic illnesses were there. So, and I'm asking you as an expert, public, so why the gap in investment that created, especially in the last 6 years, an even wider gap in terms of economic, social, and medical access?
Well, I can't speak to why the economic disinvestment, but I can say that, public health clinics were largely defunded 30, 40 years ago, and they disproportionately affected places like the East, right? That was national. That wasn't just New Orleans. I will say that, as New Orleans has expanded its FQHCs, right, that is, at least we were able to do that. And again, this is, post-Katrina, before my time. So now you do have a DePaul in the East. You do have an Ochsner Clinic out in the East because of the rise and because of the investment in FQHCs that the city was able to make. You have more. Does it replace having those clinics in every neighborhood like you used to have 40 years ago? No, but that is not the reality, unfortunately, for public health anywhere.
Yeah, I'm just interested when you talked about resource and communities, because I think it's extremely important. But another, and my last point is that you guys are involved in so much. Is it maybe the ability to, we should take a look at how we refocus or focus on closing the disparity gap in access to quality health? Could it be that maybe we're involved in too much and so much that, and not just you, but in those last 20, 30 years, especially the last 20, do we begin to refocus and just take a look, just like chronic illnesses? Because a lot of the issues that you mentioned, if there was access to health care, that those questions would be answered.
No, I agree. And we're excited to have the funding that we do to address chronic disease. And if you read our reports, you will see that every one of them highlights the disparities and has specific recommendations on how to combat them. But there is no, the vast majority of our funding is grant funding. And when you have grant fundings, you got to do what the grant says. So if the council would like to support building out a more robust chronic disease team that could help in that work, we'd be all for it. Right now, we sort of do as much as we possibly can with the funding that we have.
Yeah, I would like I said, I was just, when you mentioned expansion to an area where the gap in medical, access to medical, the disparity and all the other deserts are so wide. It's just interesting. So I would really like to either help or work with you. You're talking about how do you expand to an area that represents the highest demographic in the city.
No,
and would be
we're there. We'd love to be there more.
And would be the 7th largest city in the state, and not have access to areas that folk downtown have, when the need is actually greater in those areas. So I look forward to those answers and how we do that.
Sure. Thank you.
I think one quick question, maybe a little bit broader one. For Ubuntu, it looks like they won't have much funding left, and so I don't know if that's just I'm reading it wrong, or is there going to be continuation of that program?
No, so that's just their ARPA funding.
Okay.
So they were our partner in the DOJ grant.
Right.
That grant continues for 2 more years. So this was just the kickstart to get them started in the work. In fact, I think they have largely spent down that entire
Yeah.
amount and have transferred over to the DOJ work.
Okay.
So they've hired more people. Again, is the DOJ amount, sufficient, not to our liking, and also, it ends in 2 years, so we are always thinking about sustainability.
Right.
But yes, that's their initial funding.
Okay. And then the last thing is I just want to say thank you to you and your team for the help with the Mental Health Collaborative. We bumped them back a little bit because of the points Councilmember Thomas was making, which is there is definite need in New Orleans East and the 9th Ward for more care. There's deserts there as well with mental health availability too. And so we want to make sure that as we're building Thrive Kids and other programs that we can assemble people at the greatest possible places and provide the most care possible.
Yep.
Thank you. All right, with that, we have a ton of cards. Oh, Councilmember Green, you want to get in?
We do have a ton of cards.
We have a lot of cards.
I have a question.
Yeah,
I was
Councilmember.
gonna wait until after the cards, but I will comment. Councilman King, and then I'll.
Go ahead, Councilmember King.
I have 2 quick questions. Dr. Vegno, I heard you mention food desert. Councilman Thomas, what defines or constitutes a food desert exactly?
I don't know. There is a definition, but basically where, just sort of to paraphrase it, there is no or very little access to healthy fresh food. We talk about food deserts, but in a lot of cases we mean food swamps, in which there is food, but it is not nutritious, of nutritious value or healthy. So you might have a bunch of fast food restaurants or corner stores that sell processed food, but not a grocery store that has a large offering of fresh food. And that, in New Orleans, the swamps may be more of our problem than the deserts, but we definitely have both.
And is it a certain distance?
It is a certain distance. Jeannie, is there? 1 mile, thank you. I knew there was, so a mile from a store that sells healthy produce and other healthy foods.
So mile,
Yeah.
okay, I'm
So
right.
parts of your district definitely fall into
Right,
that.
so hypothetically speaking, would it be in the best interest of the city to have development in the food desert?
Oh, I mean, if it supports residents being able to better access affordable, healthy food, yes. And, as I said, we now have 2 staff that are working on this community-wide. I think there is a real, food insecurity has sort of come and gone as a hot topic, not for us, but I think in the sort of public mindset. I think we're at a really good point to be able to bring in a lot of partners, and so we would love to work with your office on ways to encourage. I mean, Sankofa is a great example, right? That's right in your district. They really want to be a hub for the community with a very short distance of anybody in the lower 9 to be able to not only access fresh food, but also take nutrition classes and understand the value of having, nutritious foods rather than those that are just sort of cheap and easy.
So just for example, the 9th Ward, Bywater, from Poland, I think the closest grocery store may be Robert's.
Mm-hmm.
So that's
Yeah.
an example
Yes.
of a food desert. Okay, all right, that's it, thank you.
Thank you. Councilmember Green?
Thank you. I appreciate your presentation today and also the work that you do in general. I have an opportunity to interact with representatives of your office, and I'm just pleased that the city provides such resources and such commitment to our citizens through your department, so thank you. There are a couple of things that I just want to mention. Is that the governor mentioned today that he wished to get involved more, or he was going to get involved more with the issue of homelessness in New Orleans. I encourage you to maybe.
I'm aware. We hope to continue to show the governor all the tremendous, thoughtful, sustained work that's being done. To simply move people elsewhere to get them out of sight for a concert does not fix the problem. In fact, it probably slows the progress. So we are, I know Nate and his team and several others have been communicating the good work that's happened and just the time and the investment that needs to finish the job.
And I want to applaud you and your work with the Office of Homeless Services and Strategies and others, because as we see that it has made a difference. I encourage you to maybe share some of the personal stories of those who have been relocated.
Yeah.
Maybe get them on the radio, social media, television, and the like, so people can see that they weren't just forced out of the Treme area. Many are in apartments and are doing better. And I think that that's the communication that you many times don't see outside of New Orleans. I think that we see it, but others don't see it and don't know that that's happening. So I just want to put that on to your radar. You're aware of it already. It's a worthy conversation to start having now, that we appreciate the support, but that there are some things that are being done pretty well.
Thank you.
The second issue is that I just want to ask you to be as deliberate as you can and ask for council assistance wherever is necessary relative to the epidemic of fentanyl abuse and overdoses that are taking place. In a way, the halfway good news is that the number of deaths due to fentanyl this year is going to be lower than in 2023, but it's still much too high.
Yes.
If it's billboards, if it's direct communications, if it's something that we can do, I ask you to just let us know, because it's a tragedy, the number of people. It's going to be over 300 again this year, near 400 who have died in New Orleans due to overdoses. A lot of those are fentanyl. If you'd like to comment on it, you can.
No, thank you. And again, we have a team that works on this, lives, eats, breathes, sleeves this, and we've made a lot of progress in terms of education and outreach on naloxone and partnerships. EMS has some really transformative things they do with Odyssey House to try to support people. We're working with the emergency departments to try to get people with OJC, because we know that folks that come out of prison are at extremely high risk of overdose if they don't get linkage to care and Narcan. But we need to use our settlement funds to really transform that, to have something that is accessible 24/7 for folks, that is, of the harm reduction model, compassionate care, linked to all the other systems. And so, like I said, you'll be seeing that request for proposals coming out very soon. I feel also very strongly that whatever funds are left over need to go towards a communication and outreach campaign. I think it should not just be Orleans. Our neighbors in Jefferson, St. Tammany, St. Bernard have also very serious problems, and drug use does not stop at the parish line. So I would really, really hope to work with our parish colleagues to have just a broad communication campaign of where people can get help and how they can be supported. So I would love to work with you on that.
I am so pleased that you mentioned the regional approach, because I've been talking about it a few ways involving flooding and involving insurance issues and the like. But unfortunately, as much as sometimes the issues get maybe not given as much attention here, in parishes that are near us, they get no attention.
Yeah.
I don't know if that's a desire to make it seem as if those problems don't exist, but they exist throughout our region. And you're right. I know the numbers of those who are deceased in New Orleans, but I also know that there's an issue in other parishes, and you're absolutely right. I think that we can address it on a regional level, and those are the kind of conversations that when the governor wishes to, work with us, we can work with more on a regional level. So thank you for bringing that up, and I look forward to the request for proposals.
Sure.
Too. The third thing is that I just wanted to ask you, this is Domestic Violence Awareness Month. And just last week, unfortunately, 2 weeks ago, we had yet another murder of a woman by a domestic partner. The police department did their job. They conducted they made the arrest. It happened to be in another parish. There are organizations, including a couple that are represented here today, that are focused on providing support to victims of domestic violence and victims of violence in general. I'm just asking you, it's not an issue that you have to respond to, that to the extent that we can help, let's be deliberate in working with the victims of violent crime, domestic crime and the like. We had a meeting just last Wednesday at the sheriff's office, a good turnout. But what was striking about that turnout was the people who were there who cried because they felt that the system does not provide them with the support that they need. Many times, unfortunately, we focus on the aftermath in terms of the justice system and protecting the protecting all to make sure that constitutional rights are upheld. But then we forget that there are people who are crying every day because they've lost someone. They've lost someone in a senseless act of violence, such as took place recently at the Rouses, for example. It's now been 2 years. Just someone who was unprepared for the type of violence that they would be experiencing due to a phone call. Sometimes it doesn't necessarily require a response, but you can. But I'm just going to ask you to be as deliberate as possible, recognizing the trauma of the victims of violent crime continue to afflict our citizens in large numbers. And we don't do a great job of providing resources to them. The council has provided a fund that will provide some direct support, but that's just the beginning, and that fund isn't even in place. The council has done its job. That fund isn't even in place. That's a whole another issue by itself. But to the extent that you can, I ask if we can just be as deliberate as possible, and you can ask for and work with those organizations that provide support to victims of violent crime. We can do more. What can we do more? And it is a health issue.
Yeah, and I would just thank the council again for the support for the Trauma Recovery Center, because that is a free resource for any victim of crime. And I will say, we have some reasonable policies that protect survivors, but we need to make sure they are always enacted. Things like the firearm transfer laws, things like the Gwen's Law hearings, right? So we when those are not regularly done in the way that they should or could be, that means victims fall through the cracks and we get the outcome that happens. So what our office does is a lot of trying to coordinate all of that. We need everybody to have a real singular focus on this. And I do think that is happening, but not fast enough, quite frankly.
Do not hesitate to be critical of wherever we need to be critical, because it is a health issue.
Yes.
In addition to much of the focus is on the law, under the law enforcement category, but it really is a health issue. And just seeing so many persons who've been victimized by crime coming forth to say that they didn't feel comfortable with the system or they didn't participate is not a reflection on the fact that the resources don't exist. Let's just continue to talk about it, especially as a health concern.
Thank you.
Thank you.
All right, we have quite a few comment cards, and I'm just going to remind everybody, this is not a voting item, so we are going to allow public comment, but I'm going to ask everybody, please keep your comments to 2 minutes, and I'm going to be pretty strict about if you exceed that limit, because there are so many cards and we want to get to everybody. First up, Bryn Como, followed by Haley Holton, and then Samantha Flournoy.
Hi, good morning. My name is Bryn Como, and I'm with New Orleans Food Policy Action Council. I am just here today to encourage City Council to continue to fund food access efforts through the New Orleans Health Department. New Orleans, a city famous for food, is one of the most food insecure metropolitan areas in the nation, and food insecurity has impacts deeper than hunger, including effects on mental and physical health. Please continue to fund positions like the Food Access Specialist and to support partnerships with organizations like NOLA FPAC and Top Box Foods and Market Umbrella that address gaps in the food system.
Thank you. Haley Holton, Samantha Flournoy, and Jan Tarantino.
Good morning.
Good morning.
Thank you, council members, for your recent increased support in critical health interventions, including local food procurement, as well as our work at New Orleans Food Policy Action Council. I'm requesting continued funding for health initiatives, including the Food Access Specialist position at the New Orleans Health Department. Luke Felty currently holds this position and has been an immense help with our food access working group at New Orleans Food Policy Action Council. This is a multi-organizational group led by Luke and myself that dedicates their time to analyzing food access barriers in the greater New Orleans area and creating solutions to mitigate the barriers. Louisiana has one of the highest rates of food insecurity in the country, especially among children and the elderly, and we know that a lack of access to nutritious foods causes an increase in health disparities and chronic disease. There's a common misconception that people simply don't understand how to healthfully eat, when in reality, access is the root of the problem. The Food Access Specialist position has allowed for more capacity in my own work, as they are able to help lead the food access working group, taking some of that work off of my plate, allowing me to allocate more time to implementing food access programs such as the Farm to Early Care and Education program that provides educational activities, school gardens, and fresh local food incorporation in Head Start centers across the city of New Orleans. Councilmember Green was actually able to witness this program in action this time last year as we unveiled a new garden at Wilcox Academy and shared his enthusiastic support for the program and its aim at increasing local food procurement and growing throughout our city. The food access specialist position at the health department has served as a common ground of source of information that has allowed for more capacity for our coalition of organizations to address food access needs and priorities across New Orleans and the state of Louisiana. Thanks for your time.
Thank you. Samantha Florinor, Jan Tarantino, Hillary McGuire.
Good morning, council members. My name is Samantha Florinor, and I am representing the New Orleans Food Policy Action Council, and here to support the continued and expanded funding of the New Orleans Health Department, specifically for the food access specialist positions and all funding for food access interventions and programs. The New Orleans Food Policy Action Council and NOHD has a long-standing partnership, including a shared staff member who has added capacity and serves as an important resource for the community as it pertains to food access. New Orleans has high rates of food insecurity, including childhood food insecurity and high rates of diet-related diseases. Research shows that equitable policy can help alleviate the burden of high poverty, food insecurity, and disease. Furthermore, as a city that is prone to natural disasters, which are becoming more damaging and life-threatening, having a strong, supported health department is essential to creating a resilient food system that feeds all. Thank you.
Thank you. Jan Tarantino, Hillary McGuire, Charlene Ho.
Good morning.
Good morning.
I wanted to say thank you to the City Council.
Lower it.
And
You can lower the microphone if you need
Sure.
to. Yeah, there you go.
Sure.
Make it easy. So am I. So make
Thank-
it easier for you.
Good morning. I wanted to say thank you for the funding to the New Orleans Health Department for their vision of access to care and to quality of life. I represent RHD, Resources for Human Development, which administers the MCIU unit. I can tell you the importance of that funding and how the impact has been. Just to give you a snapshot, last year we did over 3,000 calls. Last month, we're now up to over 400 a month rollouts, representing about a 35 to 40% decrease in police responses because we're offering an alternative that gives the right level of care at the right time. The community has been very positive about it. We get their feedback often with participant experience feedback. We are plugged into the city, and we hope to continue the vision of access to care and the impact of the community. Thank you.
Could you mention publicly the acronym, what it stands for, so that the public
Yes, Mobile Crisis Intervention Unit. We get all of our referrals from the 911 system. When a call is nonviolent, we respond as an alternative.
Please, members of the public, recognize that there are alternatives to a police response to instances where there are instances of mental health challenges or instability that don't involve violence. It's important to recognize that because you hear these stories nationwide, but people don't sometimes know that a lot of calls take place that involve actions involving professionals and the police aren't there.
Yeah, the
So it's
vision of
important to
this City Council and New Orleans Health Department has really put New Orleans on the map with this innovative program. I have to say that the footprint nationally and internationally has been pretty incredible. A lot of interest. Thank you.
I just said St. August here, so you're excited, right? All right, Hillary McGuire, Charlene Ho, Melissa Gordon Evans.
Good morning. My name's Hillary McQuay, Program
sorry.
Manager. That's okay. A common mistake. Program Manager for the Law Enforcement Assisted Diversion Initiative. And I want to thank you for your support. City funding to lead New Orleans for expansion from just the 8th District to the 6th and 7th Districts is off to a strong start. We're working with 44 participants now in those two districts for a total caseload of 106 individuals. LEAD is New Orleans' only pre-arrest and non-arrest diversion program. We offer officers another tool in their kits to respond more effectively to people who commit low-level offenses related to unmet social service needs. Officers either responding to calls for nonviolent offenses or encountering someone known to have repeated encounters with law enforcement that are a result of that individual surviving substance use disorder, untreated behavioral health needs, homelessness, or trauma can call lead case managers, and if the individual consents, they're diverted to community-based client-centered case management. Unlike many forms of diversion, LEAD doesn't impose sanctions, mandate behavior, or demand abstinence. Instead, LEAD's approach is grounded in the evidence of what works best to support complex people with complex needs. The fact that we do not discharge participants for noncompliance and remain alongside participants through thick and thin makes us unique in the social service landscape of New Orleans. This year, case managers have spent hundreds of hours directly with LEAD participants, establishing rapport, providing housing advocacy and assistance, attending court in support of participants, helping them get into care, providing transportation to court dates and medical appointments, and rides upon release from jail to a safe place to stay. Here's one or two stories of people whom LEAD has been able to assist in their journeys. Someone I'll call Mary is a social contact referral from NOPD's 6th District.
Thank you. That's your time. Thank you. Charlene Ho, Melissa Evans, Sophia Rosenblatt.
Good morning. My name is Charlene Ho, Director of Community Health at Ochsner, and I oversee the Family Connects New Orleans program at Ochsner Baptist. I'm here today to express support for the continued funding of the Family Connects New Orleans program. This universal home visiting program is one of the solutions being explored to address the maternal and infant mortality crisis in our community. Thanks to the support of this council, we've been able to provide this service at no cost to families in Orleans Parish. Through this program, a nurse visits the family's home after birth to ensure that the birthing parent is recovering well and that the infant is developing as expected. These visits are crucial for offering guidance and support during a vulnerable time. Family Connect serves all families of newborns, including foster, adoptive, and bereaved parents. Recently, one of our nurses visited a mother who tragically lost her infant after delivery. This care isn't just about physical health, it's also about emotional support during life's most challenging moments. We also support first-time parents who may feel anxious and just need reassurance that they're doing a great job. This simple reassurance from a nurse can make all the difference in a new parent's confidence. These visits often provide the comfort and guidance families need to navigate the first few weeks. Family Connect's vision is to create a world with equitable outcomes for each and every newborn. In alignment with this vision, Ochsner is proud to partner with the City of New Orleans through this public-private collaboration. In addition to the City Council's investment, Ochsner has committed resources to this program, including physician time, administrative support, and program oversight. Since our launch in July, over 200 families have enrolled into the Family Connects program, underscoring the demand and positive impact. I want to reaffirm my support for this program and encourage the Council to prioritize this item. This collaboration between Ochsner, City of New Orleans, and Toro truly makes a life-changing difference for our families. Thank you.
Thank you so much. Melissa Gordon Evans, Sophia Rosenblatt, Dr. Trishonda Grace.
Hello. My name is Dr. Melissa Golden Evans. I'm a maternal and child health researcher at Tulane University School of Public Health. And we are the external evaluator of Family Connects program, and I'm here to offer my continued support for the program. I have so far, and my team have so far interviewed about 30 participants who have gone through the program, and the feedback is overwhelmingly supportive of the program. And it's really important and it's valuable because these home visits occur at a really crucial time during the postpartum visit. So I just want to share with you a few quotes from our participants that are indicative of a shared experience that a lot of them have had. For the timing, they say it's always helpful to have someone come in because you end up with this kind of space between a doctor's visits right before you go in a few days later, and then it's a month before you see your doctor again. And in that in-between time is when a lot of stuff can be going on that some of you might think is just normal, and it really isn't, or just to be that you're doing a good job and that you're doing things in the right direction.
Let's see, and another one said, I think the program's wonderful. It gave me a peace of mind that we're really needed at that moment. Someone else said it wasn't just about my experience as a mom at that moment. Our nurse talked to all of us and included us as a family. So it was really nice to have someone kind of see us not just as individuals, but as a family. She gave us wonderful advice when it came to making sure that we were taking care of ourselves as individuals. And that's really important to have someone else say. Let's see, another one I wanted to share that are more specific problems, but also are common and recurring problems that a lot of moms have. Let's see. Some people said it would be a little worse if it didn't have because it would really help with their mental health. And one woman was a second-time mother, and she said, I didn't have this the first time, but just covering my basic needs now, she really understood me, and she helped me be a better mother.
Thank you, Dr. Evans. Sophia Rosenblatt, Dr. Graves, Taisha Davis.
Good morning. My name is Sophia Rosenblatt, and I'm the Director of Programs and Partnerships for Saul's Light. We're a nonprofit which provides support for New Orleans families with babies in the neonatal intensive care unit or the NICU. I want to thank you for your support of increased investment in important health interventions in recent years. Currently, Saul's Light is partnering with Family Connects New Orleans to ensure NICU families in New Orleans will have reliable and timely access to hospital-grade breast pumps. A lack of access to these pumps have been a critical gap for many NICU families, where breast milk is liquid gold for premature medically fragile infants. We are also working with the health department to create emergency preparedness kits. These kits will support families during hurricanes, evacuations, and power outages. We know that our partnership with the health department will both reduce disparities and advance health equity for NICU families. In the 2025 budget and beyond, I encourage your continued support and investment in this important programming. The support of the council is really vital to improving these health outcomes. Thank you.
Thank you. Dr. Graves, Taisha Davis, Catherine Autry.
Good morning. I'm Dr. Graves, Executive Director of the New Orleans Family Justice Center. On behalf of the New Orleans Family Justice Center, I stand before you today along with Nanette Saucier, who's the Director of Finance, and Kevin Williams, who's the Director of the AIR program, the Advocacy Initiated Response program, to say thank you for the funds allocated to assist survivors and families of violent crimes, particularly domestic violence, sexual assault, stalking, and human trafficking. Due to this funding, the Advocacy Initiated Response Triage Team, known as the AIR team, are able to reach out to survivors within the first 3 to 5 days to follow up on the victim's needs assessments. Many times, the victims are contacted within the first 24 to 48 hours. This is very important because during these call responses, victims are able to express their immediate concerns or choose to come into the agency for additional services. These support services provide another layer to reach a survivor and family immediately to offer another safety solution after reporting to the police. So we ask the City Council to please consider this funding when allocating funding to the Department of Health for victim services in the next funding cycles to come. Thanks.
Thank you very much. Taisha Davis, Catherine Autry, Sandy Hyatt.
Good morning. My name is Taisha Davis. I'm the Director of the Mobile Crisis Intervention Unit, better known as MCIU. I want to say thank you, council members, for your continued support and consideration in requesting continual funding for programs that address access to health outcomes and impacts. MCIU allows the appropriate response at the appropriate time, 24 hours a day. We run a very robust team with an estimated response time of about 18 minutes to persons in mental health crisis. We run 24 hours a day, as you guys know, but we have been allowed the opportunity to respond to about 4,100 calls thus far this year since January 1, with an estimated time of response, like I said, about 17 to 18 minutes typically. It just allows persons as myself and other community members that are born and raised of this community, impacted in the community, but get the help that they need. I too, my family was impacted by mental health. So as I lead this team, I lead as a community member, but also as a professional of this community that has been affected by mental health. And I say thank you.
Thank you. That personal connection makes a difference. Catherine Autry, Sandy Hyatt, Erica Raho.
Hello, my name is Catherine Autry. I am the supervisor of the Family Connects program at Touro Infirmary. And I'm not going to repeat everybody just talk how great Family Connects is. I just have to say that at Touro we've seen over 460 moms in our 1 year, and everything that they say the program is for, we've been out there preventing, intervening in, and supporting and referring our families to. I also want to say that I attended a maternal health symposium put on by New Orleans East Hospital and the Black Nurses Association around safeguarding minority mothers, reducing risk, and saving lives. That exactly is what Family Connects does. And our highest zip code of visitation is 70126, which is New Orleans East. And then 70119 is our second highest. So we get even more moms in the New Orleans East zip codes. However, the program is voluntary, so some of them are not accepting or saying yes to the program. However, I wish I had the total number of New Orleans East zip codes that are eligible, but 70126 is our highest visitation zip code. So it is important to see those moms continue this program. It's universal, so everybody, just so that you all know, everyone can have the program. But New Orleans East is a big area, and we are looking into bringing some education and things on a routine basis to New Orleans East through other programs that collaborate with Family Connects. Thank you all again for extending our funding through 2029, and hopefully it'll go beyond.
Thank you very much. Sandy Hyatt, Erica Roja, and Dr. Annalise DeWolf.
Hello. If it's okay, we're going to go together, Erica Raho and Sandy Hyatt.
Sure.
So I'm Dr. Erica Raho. I am a trauma psychologist and director of the Seeds of NOLA Trauma Recovery Center at UMC. I just wanted to thank the council for their support of the center, as well as the hospital-based violence intervention program. Since the beginning of the year, we've had just about 1,700 in-person patient contacts. That includes both inpatient in the hospital at bedside and also outpatient. But not included in this number are the hours of community outreach that we've spent, and also work with our community partners like Ubuntu Village, United Way, Southeast Louisiana Legal Services, and many more, as well as development of new partnerships. When we presented here in June, Councilman Green recommended that we bombard the airwaves, and we are currently working on strategies for doing just that. And so we're hopeful that in the upcoming year, more and more people in the community will know about the Seeds of NOLA Trauma Recovery Center.
With your help, we've been able to access more families. Before, Dr. Raho and I were just trying to hold down the fort ourselves, which was really hard to do, a two-person job with just a few trainees cycling through. Now we've been able to work with whole families at a time, and I think that outreach and that holistic care, treating an entire system, is what makes a difference. And we've also been able to help our team as well. We have so many wellness activities to support the people doing this work, because this work is really hard. So thank you for helping us plant seeds in the community and with our team members.
Thank you all so much. Dr. DeWolf, Lonnie Grenier, Britton Forsyth.
Hi, everybody. I'm Dr. DeWolf, the medical director for the Seeds of NOLA Violence Intervention Program at the University Medical Center. So thank you. Thanks to your support, this is the first truly hospital-based violence intervention program at UMC. With the benefit of working in partnership with our Trauma Recovery Center, we're able to provide trauma-informed, evidence-based best practices in intervening in violence. Because of your support, we hired 6 violence intervention specialists and violence interrupters who are incredibly talented, credible, and trained individuals who are bringing their passion to this work. In the 9 months since we went live, we've interacted with over 180 individuals who have either survived gun violence or, when they didn't survive, with their families. We're providing emotional support, we're providing crisis intervention, and we are reducing risk, both short-term and long-term, for ongoing violent injury. Due to their work, our team believes that they have prevented and de-escalated 29 different instances where people were talking about retaliation, which means 29 times that cycle has been stopped due to this work. We're lucky to be working with the health department, who is nurturing an ecosystem where we actually work together. So we're working with Ubuntu, we're working with all of the previous partners that we talked about, and more. This work, it works, and it's just getting started, so please continue to support the work.
Thank you so much. All right, Lonnie, and then Britton, and then MEB.
Thank you, Mr. Chairman and council members. My name is Lonnie Grenier. I handle public policy and advocacy initiatives for Odyssey House, Louisiana. Thank you for the opportunity to speak this morning about how the Sobering Center budget and how the city's investment in these services is making a real meaningful difference for the people of New Orleans. The Sobering Center is a safe environment open 24/7 in which individuals who are overly inebriated can sober up and not be out impacting community safety and tourism and potentially being victimized themselves out on the street. This funding also helps to support direct Sobering Center outreach, in which our teams are continuously engaging people in the community around the availability of these services. Between July 2023 and September 2024, the Sobering Center had 6,299 total visits, averaging 420 individual visits per month. 4,779 of those served were walk-ins, 1,325 were referred by Sobering Center outreach teams, and 162 were referrals from NOPD, EMS, and the DDD in total. Additionally, the Sobering Center, being supported by Odyssey House's continuum of addiction prevention, treatment, mental health, and primary care-related services, individuals who need more intensive or additional services are connected directly to them. Between July 2023 and September 24, 206 individuals received warm handoff to OHL's medically assisted detox. 33 individuals opted to continue their treatment in OHL short-term residential program. And in the same period, 59 individuals visiting the Sobering Center required more intensive care and were transported directly to the emergency room, as opposed to that person languishing on the street without resources or with real unmet needs. Lastly, to concur with Dr. Avegno, I do want to highlight there has been a notable increase in utilization of services at the Sobering Center. In 2024, we're averaging 549 individuals per month, and we anticipate 6,500 or more individual visits before the end of the year. So this does, in fact, save lives, provide a critical service, and we thank you for the ongoing support. Happy to provide additional information as requested. Thank you.
Thank you, Lonnie. Britton, Michael Burnside, Andrea DeVira.
Hey, y'all. I'm Britton Forsyth. I'm the legislative coordinator at Step Up Louisiana. We're a membership-based organization that fights for good jobs and good schools. We work with the health department on a lot these days, and I mostly am up here just to shout them out like a lot of other folks have, that they're a wonderful partner, a really good faith partner, and I think we've been able to do some great stuff with them. I also want to put a plug in that we will be pushing for money soon for a healthy workplace coordinator of some sort to push that initiative forward and try to work with business owners to improve the working conditions at their places of employment and to help other business owners get there, you know? We have also been in a lot of conversations with the health department about keeping school buses safe in different ways, temperature control, stuff like that. That's been really appreciated. And then you can see I have my Dollar Store shirt on today. There's been big closures out in the east of Dollar Stores. I know Councilmember Thomas is very aware. And we've been talking to them in the Office of Economic Development and Councilmember Thomas's office about really putting big investments in fresh food retailers out in the east. I think it's incredibly important. I know there's already an amount of money that you want to do. Up it. I'm all for it. I think it's folks out in the east. We have a lot of members out there, and obviously we were working with those Dollar Store workers for safer stores and better pay. And those folks deserve good jobs, stable jobs that take care of them, that pay them a living wage. And our members out in the east deserve to have, grocery stores that they can go get whatever food they need at an affordable price. Thank you.
Thank you very much. Mr. Burnside, Andrea, Erica Zucker.
Michael Eric Burnside, 2215 Felicity. I'd like to thank the Health Department for its dentist. I use the dentist at 2222 Simon Boulevard, and I am grateful for it. I'd like to thank the Health Department for Ben. Ben used to know me before he got employed, and his job is basically to make sure that when our next IDA happens, it doesn't bring about a lot of dead senior citizens like our last IDA did. I'd like to thank our breastfeeding mention. My mother was part of the Logi League back when it was not quite fashionable, and I benefited from it, so that was good. I'd like to thank the young man who came up to talk about the Sobering Center. As some of us know, I attacked the Sobering Center last year because last year's numbers, each sobered person cost us $1,000. So hopefully this year the numbers will be different. I've not done them yet. With regards to the opioid settlement funds, we do not have the same level playing field with Jefferson Parish with regards to funding, which is something I talked to Dr. Avegno about last year. But I would like to thank Councilman Green for his bringing up the 300 to 400 people are going to die this year because it's the silent killer. We don't consider it violent crime for some reason. With regards to encampments, I am grateful to the Health Department for cleaning them. They've cleaned them for a long time. Sanitation cleans them, but it's Health Department that led, and I'm grateful for it. With regards to decommissioning, I agree with Councilman Green. The people who have been decommissioned need a voice in our public space so that they can tell us what it's like to not be on the streets anymore. With regards to divesting violence, I think that the money that CM Harris brought to the table for DNA results because of the backlog should be publicly addressed as far as how many of them have been cleared and how many still remain in a backlog. With regards to the medical debt funding for ARPA, I think it should become a yearly budget for the city. I think a lot of people got a lot of debt cleared off, and I think it would be nice to know what the ratio was between what we spent and what we got. I'm unhappy that UMC did not take part in that this year. With regards to the money... Oh, I had another couple...
It
turned red.
Go ahead. That takes 7 seconds. Go ahead.
7 seconds. 7 seconds. Thank the Lord Almighty God for people that give a shit. All right, so in regards to the rest of it, your numbers don't add up, but I'll send you an email.
Thank you. Andrea, Erica, Sarah Amojala, Kim Mosby, and Maggie Herman.
Hi, my name is Andrea Daviera. I'm a postdoctoral researcher at the Violence Prevention Institute at Tulane, which is a member of the Big Easy Budget Coalition. I recently graduated with my PhD in community psychology, and I moved to New Orleans to work on violence prevention research and advocacy efforts. I quickly fell in love with the city, and as a resident who's been working to get to know the community, I am very aware that many residents are concerned about health and safety in New Orleans. This is why I'm firmly asking that the City Council fully fund the Department of Health as requested, as well as the specific lines advocated through the Big Easy budget deal. I know very well that violence is a health issue, and cities struggle with violence within their communities when they are facing food, housing, and economic insecurity and a lack of opportunities. We can create more safety directly through funding the things that create security, which is what the Big Easy budget advocates for, as well as the Department of Health, specifically by funding things that support and expand violence prevention and community safety programs to fight food insecurity and increase access to foods, to fund school-based interventions that help keep kids in school when they get into trouble, and to expand home visiting programs are all things that will directly support safety and reduce violence because they create the stability, health, and opportunity that people need who are currently struggling. That's all I wanted to say. Thank you very much, and please do fund the health department. Thank you.
Thank you. Erica, Sarah, Kim Mosby, Maggie Herman.
Good morning, everyone. Erica Zucker. I'm the Director of Policy and Advocacy of the Workplace Justice Project. We are a member of the Big Easy Budget Coalition. I am here to commend the Health Department for its effective focus on the public health and safety of all of our residents and support continued and increased funding for these programs. New Orleans Health Department programs have an important and measurable impact on the economic security of New Orleans working families. I want to highlight especially the medical debt program and the food security funds, both of which were funded by ARPA funds and need to continue. We work directly with the Health Department on the Community Health Initiative and Supportive Work Environments programs, where we are working to expand workers' rights education and efforts to expand access to health care, both of which are components of the Workers' Bill of Rights. I want to emphasize the need to fund personnel so that these programs continue and expand. We need staffing to put in place a director for the Supportive Work Environments program. And this is a preview of my comments you're going to hear on Wednesday. We need to look at how we coordinate enforcement of all city policies that protect workers' rights. So again, I just want to commend the Health Department for everything that they're doing and ask that this City Council support the asks in the Big Easy budget deal to make sure that these programs keep being funded. Thank you.
Thank you. Councilmember Green, do you want to speak now after? Okay. Sarah Modula, Kim Mosby, Maggie Herman, and then we'll let Councilmember Green, we'll read the one online comment.
Hi, Sarah Modula, Vera, Louisiana, member of the Big Easy Budget Coalition. Also, Britton wanted me to tell y'all that he's also a member of the Big Easy Budget Coalition. I hope I get those 7 seconds back for that. So the Big Easy Budget Coalition wants and advocates for safe and thriving communities everywhere, from Algiers to the New Orleans East. Safe and thriving communities are places where people have access to fresh food, where we stop violence before it occurs, and support people healing from harm that has occurred. And we get a good return on our investment. So that is what the Health Department provides and has played a crucial role in maintaining the public's well-being and quality of life, especially during and after the height of the pandemic. So thank you for that. As part of the Big Easy deal, the coalition is asking for $6.2 additional million investment in NOHD to expand the community-based violence intervention and prevention programs and address food insecurity and maintain restorative programs and provide flex funds as part of their violence intervention programs. In June, the Health Department and Ubuntu Village and Center for Restorative Approaches presented about their work in Central City and the 7th Ward, and those programs are working, and they actually want to expand to the East and Algiers. And so in order to do that, they need $1 million, and that amount isn't here in the budget. It wasn't able to be proposed, and actually we need City Council members to amend that into the budget. It also needs to be recurring. There are quite a few programs here that are funded significantly by one-time funds, but people are recurring. We need these things all the time. 15 seconds, I want to put a really finer point on the food desert conversation. Deserts are naturally occurring landscape things. What we actually have when people have no access to food and they don't have access to fresh, healthy food is actually a result of lack of investment and bad policy. And so that's actually what we need City Council to make a change on. Thank you.
Thank you. Kim Mosby, Maggie Herman.
Let's see if I can hold a sign and talk. All right. I stand here today as a resident of District D, a member of the DOJ Community Violence Prevention Steering Committee, and a community researcher working with Vera Institute of Justice and the Big Easy Budget Coalition. This summer, my team collected over 300 survey responses from across the city to learn how community members want their tax dollars invested. We found that mental health care is one of the top 5 priorities of all respondents, and that 92% believe the city spends too little in mental health care services. To that end, I request the City Council amend the current proposed budget to fully fund the Big Easy deal, which includes an additional $2.6 million to the Health Department to expand the NOLA Peace Ambassadors program to New Orleans East and Algiers, so that the Trauma Recovery Center can meet the mental health needs of all Orleans residents, to expand the reach of school violence prevention programs, DV programs, and food security programs, and includes $80,000 in flexible funds to meet emergency needs of those impacted by gun violence. Woohoo! A both-end approach to safety means we have to fund upstream preventative measures, including housing, workforce development, and educational opportunities, youth services, and provide supports to low-income families, especially providing food security and mental health services to all in need. Please continue to support this vital work of NOHD, the Office of Violence Prevention, and Ubuntu, and all facets of the continuum of care in order to build and maintain safe, thriving communities in New Orleans. Thank you for your time today.
Thank you very much. Maggie?
Hello, my name is Maggie Herman. I am the Deputy Director with the New Orleans Children and Youth Planning Board, and I'm also here to represent the Youth Master Plan, which is a 10-year plan about positive youth development in the city, data, narrative change, and investments, one of the things I'm here to talk about today. A healthy community is a safe community, and safety is the presence of connection, and we know that safer, thriving communities takes investing in connection. The health department does this through a myriad of programs, some of which we heard about today. As a member of the Big Easy Budget Coalition, we're calling for an additional investment of $6.2 million, alongside fully funding the health department for their asks, to expand their community-based violence intervention and prevention programs that fight food insecurity and maintain restorative programs that create a continuum of care for youth and the communities that they live in. The health department plays a crucial role in maintaining the public's well-being and the quality of life, and is a key player in the connected network of offices, departments, and community-based organizations that wrap around and support young people, their families, and the communities they exist in. There are 3 specific things that are in the Big Easy deal that I want to highlight. One of them is already mentioned, the Family Connects program that connects nurses to new and young parents. This is a solution in the Youth Master Plan that many community members have called for and we heard have benefited from so far, so we're hoping that can be a recurring and ongoing investment. We also look for expanding restorative approaches in schools. As you heard in a presentation from the Vera Institute, there is a lot of community ask for investing in youth and their education and their learning. Restorative approaches in schools keeps young people in schools. It keeps them from being disconnected when they have an opportunity to repair and restore, and also expanding prevention approaches outside of schools and in community. These initiatives are responsive to asks and youth-led solutions. Thank you so much.
Thank you. Councilmember Green.
Thank you to members of the public who gathered today. I want to thank the Health Department for its presentation. I'm so glad, I'm so pleased that some young people are here today who registered to vote at age 17 and are able to vote at age 18. And they are here today. Yes, they're from St. Augustine High School, but I also wanted them to be here to see what the Health Department is doing and what our City Council is doing. They heard many mentions of thank you for the City Council for providing the funding for a variety of programs that are helping to enhance the quality of life in our city. But I'm just so pleased that they came down and wanted to hear a bit more of what was going on, and the budget process is a great time to hear that because they recognize the complexities involved with city government. So I just want to ask them just to stand for a second. They're going to go and vote. But as I mentioned, to all high schoolers, you can register to vote at the age of 17. You can't vote until you're 18. And of course, this is early in the year, so there are only a limited number. And what you see is those who turned 18 and can participate in this, their first election. So I'm pleased that they're here. And I thank the Health Department, the City Council, and all the advocates who want to do those things that are required to enhance the quality of life for all, because it's all about providing a secure future for our youth, such as are represented today. Thank you. Now, let's go vote. Ismael? Let's go vote.
You voted already.
Oh, you voted already? What? So did I. So I'll meet you out. You're going to stay for a little while, as long as you can, and then I'm going to meet you out in the
You
courtyard.
can go vote again.
Yeah, that's right.
They're going to say you did
In the
anyway.
spirit of Louisiana. That's right. Spirit of
All
Louisiana.
right, Ms. Spears, we have one online comment. And
Yes.
I think we are concluded with Health Department.
This comment
Thank
is
you
from-
all for St. Aug for being here.
Sorry. Comment is from Cameron OKK. On behalf of the Big Easy Budget Coalition, the Health Department has played a crucial role in maintaining the public's well-being and quality of life, especially during and after the pandemic. The Big Easy Budget Coalition calls for a $6.2 million investment into NOHD so they can continue to expand their community-based violence intervention and prevention programs, fight food insecurity, and maintain restorative programs that create a continuum of care for youth. Addressing violence as a public health concern creates lasting safety. We have taken important steps towards building a continuum of care and violence prevention. We must continue to fund these interventions to maintain reductions in violence and maximize thriving outcomes for all. That's it.
Thank you very much.
Welcome.
Thank you very much to the Health Department for being here. All right. Last but certainly not least, the Office of Information and Technology.
Yeah, she's really, yes.
All right. Good morning, whenever you're all ready.
We're ready.
Yeah, great. Thank you all for being here.
Good morning, council members. I'm Kimberly LaGrue, Chief Information Officer and Director of the Office of Information Technology and Innovation. With me is Eric Ogborn, our Director of Enterprise Information, Julie DeVoren, our Director of Technology Services, and Gary Jones, our Acting Director of Operations. Getting into our budget presentation for the 2025, our progress on our 2024 departmental goals. We had a goal to procure and launch a multi-level departmental street-level asset management system. Reporting that that project is on schedule. Our go live is March 2025. And in addition to that project and its implementation, we've identified a new 311 system to replace the QuickBase system at Orleans Parish Communications District. We also looked to, during this year, evaluate AI-based cybersecurity programs. That evaluation is underway, and we look to make a decision by the end of this year. And also finalize our public Wi-Fi deployment strategy and complete proof of concepts. We made significant progress this year, releasing an RFI for public Wi-Fi, and also what we have on the street in a day or two would be an RFQ, which will qualify multiple vendors for proof of concept implementations. We also utilize learnings from improving the Wi-Fi at Joe Brown Park for large events. So we have completely outfitted Joe Brown Park with public Wi-Fi. It served the Warrant Clinic in August for the law department, and it is a model that we can use across the city. And we're also adding fiber to Duncan Plaza to create public Wi-Fi as a transit hub. We'll test this out. The most important thing is this is fiber in the ground, so it actually extends the city's fiber infrastructure, and we will test this out during the Taylor Swift concert weekend. Also developing a strategy for IT infrastructure lifecycle and website refresh using alternative funding sources. One of the things that was most important for us is this year we fully staffed our web team, and we actually did that through our civil service positions. We're very excited about that.
That's great.
Our alternative funding sources would actually be our staff augmentation if and when we need further development. And we've also identified a new content management system for city websites, and we've been able to make significant progress on redeveloping websites throughout the city. Lastly, establishing an IT governance structure for our technology investments such as CGIS and the JTMP team, which is ARPA funded. We are increasing that life cycle or improving that life cycle and have interviews for IT director candidates in that space, and we will be onboarding an application support specialist for criminal justice. Both of these are civil service positions, so we are achieving that goal of creating a sustainable framework for these types of projects. Other accomplishments were pretty extensive during the year, but just want to highlight that we did successfully launch and deliver the revenue collection system for finance and built an esports network for NORD. Short-term rental verification system, various dashboards, including the public safety dashboard and the DPW 311 dashboard, and updates and new websites, specifically Join EMS, and an overhaul of even the council's website happened. Our operations team completed various updates to the public infrastructure, and we have just established a new network that connects the Crescent City Connection and its signaling system to the city of New Orleans. For 2025, our department goals are largely continuations of the work that we've done this year. We are working in our project management office. We want to streamline our implementation projects and create a framework for methodologies that we can use over and over. We are deeply involved with the asset management system project, ongoing projects, including the Inova cashiering implementation. These are citywide projects, and also the public Wi-Fi. So what we want to do is build capacity in that team and be able to be a true resource for a city with an iterative project management delivery cycle. Also, in our operations group, we look to build a critical infrastructure cyber command center ahead of Super Bowl, but what we want is visibility on all of the city's critical infrastructure and citywide reporting, butts and seats reporting in that command center for any critical infrastructure that the city has purview over. For enterprise information, we're going to migrate NOLA.gov sites to a new content management system, deliver asset management, and this integration with a new 311 system. So we'll be working closely with the Orleans Parish Communications District and our infrastructure teams, including DPW, the CAO's office, and the innovation team to deliver this project, and also launch the short-term rental verification platform. And lastly, in the areas of security, we will implement that AI-based cybersecurity platforms, and we're doing some learnings into AI and how it can be used safely in city government, and we would use those learnings to develop AI policy for city government. For 2025, our personnel remains largely the same. We had some changes in positions, but that did get us back to the 40 staff that our civil service staff. We're working closely with the budget office to fill some key vacancies, which you'll see in our organizational chart. We have a deputy CIO coming in, but that director of public safety and civil service positions in the public safety space are very important to us, along with key positions as the website and the web team are now fully staffed. If we need new skill sets, they would be in the areas of development and making those websites and that team more robust and able to tackle new challenges with the systems that we're integrating. And also, one area of need for us is an AV specialist to work on all of the new technologies that are being deployed across the city. The council has made significant upgrades and we're seeing other departments needing those kinds of skill sets. So as our budget progresses in 2025, if those positions can be filled, we will work with the CAO's office and the budget office to fill them as needed. So our proposed budget for 2025 has a personnel variance of $44,000, and that is an adjustment to actuals and positions that were remaining over in 2024. Our other operating variance of $318,000 is largely due to increases in software and licensing and the capacities that we need to serve the city. The city grows just a bit. We have other rising costs in software. We do feel like we get a good value for the increases that we're making in these areas, and we're buying softwares and licensing that make the city and its employees more productive. So we do appreciate that. And our total is $274,405 in the increase in the IT budget. That is our presentation, and are there any questions?
They have some people who want to chat. We want to thank you very much for you and your team's work. Councilmember Thomas, Councilmember Harris,
first
and then Mr. Burnside.
Yeah, thank you for the service that you and your department provide. If you guys take a holistic look at the role of technology versus the amount of unfilled positions that we have, let me say I'm a fan of actually having a human in that job. Whenever I go to the store, 90% of the time I go to the cashier, not the self-service checkout. Not because I don't know how to do the self-service, because until we start designing the self-service checkout, then I know we're trained to be the cashier or be the job. But we keep talking about the vacancies that we have. How have you guys taken a look at those vacancies versus the fact that we've not attracted more personnel in terms of efficiency and being able to do the job?
So the vacancies that we had?
Each department is talking about, at one time it was almost 1,000 vacancies and 960 vacancies. I know we've gotten some positions, but everybody's still saying they need more people. So if you need more people, then you're saying you would better deliver the service with more people. But we know that technology today, one of the purposes is so that you can still be efficient, even if you don't have the number of bodies that you used to have to do the labor.
We look at places where efficiencies can be addressed through technologies, and just try to generally stay honest about where people really need to be in a role. AI, for instance, is a force multiplier. It means a person can get a job done more quickly, but with our web team, as we mentioned, we fully staffed it for the first time, and we see other places where more development technologies are needed. So what we're doing is upskilling our workforce, and we're looking at new positions that need to be filled.
And so that's my question. As you've taken a look at the city and its workforce, the city used to have, 11,000, 12,000 employees?
Oh, wow.
Yeah, that's nowhere near that anymore. But if you guys are advancing technology, your role as a technology department, where are you saying to say, well, hold on a second, right? Though historically, we have needed to have a labor force with people representing those positions, but we can actually do that job efficiently, more effectively, and more cost-effective without suffering from not having people in those jobs and still get the job done.
That's part of why the license costs are increasing, as like Microsoft, for example, has introduced AI into its Office platform. We are looking at seeing how the AI built into Office 365 could actually benefit the city. However, there's a raft of ethical and security concerns about doing city business with AI, right? So it is one of those things that we are looking at, but we want to be very, very careful. And that's part of why the pilot and trying to put together an AI policy really is going to be important, because we want to make sure that we don't just jump in feet first and instead be thoughtful about how we begin to integrate AI into city operations.
And another question, the role of technology as you guys take a look at how we deliver services like permitting, for an example, right? Or the BRAS process, for an example. And we always talk about one stop, but too often one stop means stop, right? And I'm just looking for you guys' help and advice on how do we make one stop here at the one stop, and how do we make the permitting process, a lot more efficient and easier. And I'll give you an example about BRAS. Before this part, I worked for a professional service firm where we went through the BRAS process for a contract. So contracts that we had several. But one department would have an issue after we'd been awarded a contract, and it went through BRAS. It was signed off. You're in the middle of doing the work, and then someone in the department raises a question about a certain submittal, and then once you answer that, it's got to go back through the BRAS process again when nobody else in the process had an issue with it. How are you guys taking a look at issues like that so, we don't get this reputation of slow with permits and slow with pay, but we're not, because to me that was double work, right? If everybody else signed off it and nobody else had an issue with it, why would you send it back through the process again?
Well, if you notice, our technology services team is growing, and under Julie's leadership, what we're looking to do is put the kind of frameworks in place that allow us to take a more scrutinizing look at the implementations, and then have staff and the expertise to address where there are problems, and then create improvements in the processes that allow the technology to better be utilized by the humans. And so that those processes work more efficiently.
So you guys are given a chance to analyze those delivery of services and how technology can help, as well as looking at the processes before delivery of services and maybe how we can avoid certain double standards.
That is our goal.
Okay.
Yes. And there's two issues with, a lot of the system. There's third-party vendors, right? That it's difficult to necessarily rebuild processes through, within their systems. The other part is because there are third-party vendors and doing various things. You've got purchasing, you've got permitting, things like that. It's integrating all of those things across.
Yeah.
And that's definitely something we're looking at trying to improve.
Well, I'm just asking a lot of questions that really may show maybe my lack of knowledge or understanding of what you do, but as I read what you guys do, then to me it's the perfect opportunity to help us in those areas. It's like the Smart Cities initiative that we talked about. Of course, that thing went awry, but you don't qualify for smart cities because you're one of the smartest cities. When you qualify for smart cities, that means that they're technology deserts. So we talked about food deserts earlier and health disparities, but they're deserts. So how do now we take a look at, since we didn't do the smart cities, we still qualify in many parts of our community to be part of smart cities. What are we doing to take a look at how do we advance that effort in spite of, especially with y'all technical expertise, knowing that it's a service and an opportunity that's provided there?
So here, our technology services team, we're looking to place specialists, project managers in each of those areas. We have a successful team delivering projects for finance in the criminal justice space. We want to do much of the same thing. We actually have a special projects manager that's managing public Wi-Fi and broadband and smart cities funds. So for us, it's strategically placing the people with the expertise in the areas of city government where those kinds of things need to take place.
Thank you. Thank you very much.
Thank you. Councilmember Harris.
Hi, y'all. Do we have enough storage? This is not a rhetorical question, and Kawanda tried to help me with my email that is at 97% capacity, and we can't figure out how to get, and we're not allowed to delete emails as a city because it's all public record.
So yes, we do. Office 365 and our email system is run by Microsoft.
Right.
They have a limit that they place on each mailbox. We're looking to see if we can buy more capacity with them or other ways to archive or offset your active mailbox. But yes, we do have enough storage. So that is a cloud-based system. Now, the cost to increase that storage, we would have to consider, as Eric mentioned, we're looking at which applications or which new technologies within that portfolio we might need to increase. We do maintain cloud-based storage through that system, but we also have a on-premise and infrastructure in 2 data centers. And there has not been a project this year. The health department is deploying new strategies. The police department is deploying new softwares and new applications, but we have not come up short or had to turn any projects down because we don't have the city infrastructure to do it.
In this budget that you're presenting today, are you building in the cost of the either archive or additional storage solution, or are you just going to come to us at mid-year and ask for an increase?
No, we are building in infrastructure refreshes. So our data center team, which handles the storage in those infrastructure, we actually are completing an upgrade this year, and we try to keep it 30% delta or 30% overage in our storage capacity. And the systems that we refresh time over time usually build that in for us. So we did significant upgrades to our data centers and the redundancy between them this year. So for capacity, I don't anticipate anything large coming up that's so large that we can't handle the storage. A different story or a different idea is transitioning things away from cloud-based storage and putting it in that on-premise storage, and that could take some work. Yeah. So having the talent to do that is as important as having the infrastructure.
All right, I just want my emails to be decreased from 97%.
Yours, I understand yours have gone down to, we're in the 80s now.
I think we're like 89% right now.
Yeah, we're moving.
Uh-huh.
Yeah, they've had to fix mine multiple times, and I think I have archives on top of archives now, so I appreciate it to keep it up and running. Thank you very much for that. Mr. Burnside, you'll close this out.
A technology desert. Well, they have something to do with our education system. So, catty comments aside, the city would benefit from a little more electronic interaction with its employees, meaning I've had a long time problem with title research and code enforcement. Multiple years of trying to beat my head against the wall of title research and code enforcement. And I think it would be nice if there was an automated system that would ping up the ladder of power when title research activities do not meet certain timelines. What do I mean by that? I mean, let's pretend that I have no idea if these are real numbers. These are pretend numbers. Let us pretend that it takes 3 months to do title research. So our title research comes in, boom, it's there 3 months, it does not get done. So electronically, it's in the system, there's a little title research, it's not been done, it goes ding, and the supervisor gets a little beep on his pager, title research number blah, blah, blah is now, longer than 3 months. You wait, right? Because I got my stories about title research. 6 months comes by. Now the little supervisor's pager doesn't go ding. It's like the division head or code enforcement department division head or somebody up there gets a little email. Title research number blah, blah, blah has not been done. 6 months. Boom. Okay. Year goes by. The mayor gets a, dear mayor, title research is not being done. Therefore, buildings are falling down in O.C. Haley because adjudication is not happening because 311 requests are being archived instead of dealt with. Title research is important for the ongoing functionality of my concept of a responsive government. Too many times, too many people don't know what's going on. So part of the electronic world is reminders. Little beepers go off, little emails get sent, people up the power get notified, hey, people below you may be having emergencies, they may need more staffing, something's not working and needs to be fixed. Thank you.
Thank you, Mr. Burnside. Go ahead. Yeah. All right. Thank you, Kim, and to your team. We really appreciate it. Thank you so much. All right. Wednesday, we'll have Office of Business and External Affairs. That includes city planning, HDLC, Vu Carre, Office of Performance and Accountability, Office of Economic Development, Culture Economy, and Office of Nighttime Economy, along with Office of Community Development and Workforce Development. Take care.